So let me ask you, when was the last time you had your blood pressure checked? How about your cholesterol levels? Have you had a colonoscopy exam? A PSA test? Well, your answer to those questions should depend on several factors like your age, gender, and health status. Hello everyone, this is Gary Sams, the Chief Wellness Officer for EBAW's Benefits Administration and Wellness, and I'm pleased to be with you this month to talk about health screening guidelines, specifically the who, what, why, and how regarding preventative health screening. So let's first talk about the guidelines themselves. Who creates the guidelines that we use? Well, in our case, and in most health organizations' cases, they follow the U.S. Preventative Services Task Force guideline. And they were created in 1984. The U.S. Preventative Services Task Force itself is an independent volunteer panel of national experts in prevention and evidence-based medicine. The task force works to improve the health of all Americans by making evidence-based recommendations about clinical preventative services, such as the screenings that I just talked about, counseling services, and preventative medications. All the recommendations are published on the task force website and or in peer-reviewed journals. The task force members come from the fields of preventative medicine and primary care, including internal medicine, family medicine, pediatrics, behavioral health, obstetrics and gynecology, and nursing. How about the guidelines themselves? What are they? Well, the guidelines are based on a rigorous review of existing peer-reviewed evidence and are intended to help primary care clinicians and patients decide together whether a preventative service is right for a patient's needs or not. The standards, which were developed at the request of the U.S. Congress, seek to protect patients and ensure that clinicians receive high-quality recommendations by outlining the best methods for developing clinical practice guidelines. The task force is dedicated to developing trustworthy, evidence-based recommendations that provide clinicians with the best available information about the current science of prevention so that they can make informed decisions about health and health care. The way the guidelines actually work is that the task force assigns each recommendation a letter grade, an A, B, C, or D grade, or in some cases an I, which means it's inconclusive or incomplete information at that particular time, based on the strength of the evidence and the balance of benefits and harms of a preventative service. And the task force does not consider the cost of a preventative service when determining whether they should make a recommendation grade. So this is strictly based on science. The recommendations apply only to people who have no signs or symptoms of the specific disease or condition under evaluation, and the recommendations address only the services offered in the primary care setting or services referred by primary care clinician. So some examples of the recommendations and the grades would be an A grade, for example, around blood pressure screening. The U.S. Preventive Service Task Force recommends screening for high blood pressure in adults age 18 years or older. So again, very high, very strong, very positive recommendation for that particular procedure. By contrast, a procedure getting a D is prostate cancer screening. The task force recommends against PSA-based screening for prostate cancer in men 70 years and older. So in the one case, for individuals 18 years and over getting blood pressure, highly recommended an A. No risk versus benefit controversy there. On the other hand, prostate cancer screening for men over 70 using PSA exams only gets a D. So it's not highly recommended. Why are they important? Regular health exams and tests can help find problems before they start. They also can help find problems early when your chances for treatment and cure are better. By getting the right health services, screenings, and treatments, you're taking the steps that help improve your chances for living a longer, healthier life. Your age, health, and family history, lifestyle choices like what you eat, how active you are, whether you smoke or not, and other important factors impact what and how often you need health care and these services that we're discussing. So how do you know if you're following the guidelines, if you're current with the recommended screening procedures for someone of your age and gender? Well, the first thing that we always recommend is that all of us should have a relationship with a healthcare provider, a PCP, a nurse practitioner, a physician assistant, whomever, but someone who you have a relationship with that is a trusted source for you and your family for healthcare decisions. Along with that, because you're a part of the programs that we provide, if you've taken one of our health risk assessments and you're in our program, we provide a preventative screening timeline for people to consider. Also, within our portal, and most of the portals that we provide, in the Atom content, we have a section called Health Answers. And in the Health Answers Health Library is a complete set of information about health screening guidelines. It's very specific. It can be searched for women, men, children, and so forth, and by condition. We provide a lot of sources for you to understand if you're current on your guidelines or not. But again, we always recommend speaking with your personal physician about this to see if you're current. So in conclusion, we've heard that saying before, an ounce of prevention is worth a pound of cure. And I really like that statement a lot. And I like that approach and that attitude even more so. Taking a proactive, preventative approach to healthcare is really important for our success. And making sure that you're current on screenings for someone of your age, gender, health condition, and so forth is an important aspect of that preventative approach. So please check with your physician, check the resources that we've talked about, the CDC, the U.S. Preventative Services Task Force. They have a website themselves that you can look at. But please take an active role in this aspect of your health as well. You stand to get real dividends from that activity. Thanks so much, and thank you for your time and attention today.